I guess I'll never know what I missed on that first day of health class.
Don't have sex, because you will get pregnant and die. Don't have sex in the missionary position. Don't have sex standing up. Just don't do it, promise? Okay, everybody take some rubbers.
So some of you may recognize that was Coach Carr's infamous speech from the movie Mean Girls, utilizing scare tactics to educate teens about sex. So let's think back to your health class experience. Was it similar to the message presented by Coach Carr, or something a little, better? We recently sat down with Lindsey, the HIV, STD, TB, and Viral Hepatitis Program Coordinator from the North Dakota Department of Health, to talk shop about the ins and outs of STDs. Check it out. Hello, everybody, and welcome to Ty and Sky's Health Pub. Today, we are at the North Dakota Department of Health, and we are talking to Lindsey. Lindsey is the HIV, STD, TB, and Viral Hepatitis Program Coordinator here at the Department of Health. So, we're going to jump right in with our first question, and it has to do with terminology.
Okay.
So throughout when we've kind of grown up, we've heard the terms STI, meaning sexually transmitted infection, used, and we've also heard STD, sexually transmitted disease. Is there any difference kind of between those two, or what's going on with the two terms?
So, I mean, it's just a difference in terminology. Sexually transmitted infection is kind of a little more inclusive because not every sexually transmitted infection causes disease. So, for example, HPV can cause cervical cancer. It can cause disease, but some HPVs don't cause any disease in your body. So, it's still a sexually transmitted infection, just not a disease. So, STI, a little more inclusive of everything. STD is, the things that you would get sexually that actually cause disease.
Okay, so a little more, maybe a little more inclusive term with the
they're
STI.
used interchangeably too. So, nationally we talk about the STD program. It's just kind of traditionally what we've used, but they mean the same thing.
Wait, so they are interchangeable then? Because, if you throw a lot of acronyms around, sometimes people get a little confused at times, I imagine, sometimes, before, I'd say, oh, yeah, that's an STI, and some folks would be like, no, you're supposed to say STD, or, the reverse would happen, too, and they're like, no, we're specifically referring to, diseases, so, it's kind of interesting to hear that it's actually more...
Yeah, so all of the diseases would be infections, but not all the infections are diseases. So one's kind of like a Venn diagram inclusive of the other. So, But when you're hearing them out and about, we're mostly talking about things that cause disease are the things that we're kind of most interested in because we want to prevent disease. If you get an infection that doesn't do anything to you, then, whatever. But, so infection is potentially just having something that you've caught sexually. Disease is actually, again, something that causes illness or disease.
And so I guess how widespread of a problem are STDs? Are they just something that the general public, I'm sure most of us have had a discussion, or possibly even some of the older audience might have even had a scare at some point, maybe leaving at any point in their life, and there's always this, we always hear these, either PSAs or something about hey, make sure you get tested for XYZ. And some folks are like, well, that's not going to happen to me, or, the likelihood of me getting that's so low, even if the perception of that's wrong.
Yeah.
How big of a is it a wide scale problem, STDs in the United States?
Yeah, definitely. So CDC has put out a statistic that 1 in 2, or 50% of people who are sexually active will have an STD by the time they're 25. So it's not something that's, just happens to other people. I mean, that's half of all people who are having sex under the age of 25 are going to have something. A large portion of that would be HPV. It's very common. So thankfully there's vaccines against the, kind of the worst or the most disease-causing types of HPV out there to try to protect people from getting disease when they're infected. But yeah, it's really common. Chlamydia is really common. Gonorrhea is becoming more prevalent. Syphilis is back on the rise. So this is not something that, has gone away. It kind of mostly affects people who are kind of in that, 15 to 30-ish age range, kind of younger Americans. But it's continually prevalent in that young population. So it just kind of keeps moving through time, affecting that age group.
For sure. And if we could kind of dig in on some of those terms you use just so we can make sure we're all on the same page, maybe we'll just ask you about them in turn. Could you tell us a little bit more about chlamydia?
Yeah, so chlamydia is probably it's the most common reported STD in the United States. So not all sexually transmitted diseases are reportable conditions or things that physicians diagnose and report to like state health departments. So chlamydia is the most prevalent one. Here in North Dakota, we have generally anywhere from like 3,500-ish, 3,000 to 3,500 cases per year diagnosed. When we were looking back at our data, it's the most prevalent STD in North Dakota. Most of those folks are between the ages of 15 and 25. Females are more commonly diagnosed with chlamydia, and that's because females are more commonly screened for chlamydia. So women or girls who go in for annual exams, if they're sexually active, would be screened, would be found to be positive. That doesn't necessarily happen for males. So we would suspect that males and females have, kind of like an equal chance, especially in that, people who are having heterosexual sex to have chlamydia. But again, mostly diagnosed in girls. Just because of that access to healthcare issue.
Yeah, and would chlamydia kind of appear differently in males than it does females?
Absolutely. So, most females are asymptomatic. They don't know that they have anything. They wouldn't have any sort of discharge or painful urination, things like that. Men who would have symptoms would probably be more likely to have, some type of discharge or painful urination that would cause them to go in. But largely, people wouldn't even know that they had an STD. They feel completely normal or have chlamydia.
So if it actually hurts when I urinate, should I be concerned at some point?
Yeah, I think so. Yeah, for a variety of reasons. So, just because it burns when you pee doesn't mean you have chlamydia or gonorrhea or some type of STD, but you definitely probably have some type of infection going on that you need to get seen for.
And what about, I guess, in terms of because we always hear about UTIs and stuff like that too,
Which is, what do you mean by UTI?
Oh, UTI, like a urinary tract infection.
Sure.
And so and here's a question then, I guess. Is a UTI actually classified as an STI? I know that might sound like a silly question.
If you would have chlamydia or gonorrhea or something like that, it would be a urinary tract infection. So, but again, not all UTIs are caused by chlamydia and gonorrhea. You can have E. coli and other kinds of bacteria and things that would cause a UTI. But yeah.
So basically, you're saying that the difference is kind of like we had talked about the Venn diagrams in the past. So these are all sort of, if I'm picking up kind of what you're putting down, these are all bacterial infections.
Yeah.
And so UTIs just in general are a bacterial infection.
Yeah.
Could be caused by chlamydia, gonorrhea.
Yeah.
Could be caused by something that is not chlamydia or gonorrhea.
Sure.
Perfect.
Yep. Just got to find out what it is and get the right antibiotic to treat it.
Perfect. And kind of a question that comes to my mind too. So we've talked about what we can expect as far as symptoms referring to vaginal intercourse in a heterosexual relationship.
Yeah.
So can chlamydia, since we're talking about that specifically, affect different parts of the body based on how two people are engaging in sex? So if we talk about oral sex or anal sex, do we have different findings?
Absolutely. So you can become infected with chlamydia in your throat. You can become infected with chlamydia in your rectum or in your anus. If you would be having anal sex, it kind of knows no bounds, I guess, in terms. So whatever location you'd come in contact with that bacteria, it could cause an infection in that area. For that reason, we're really starting to push site-specific screening for chlamydia and gonorrhea because they're tested for together. They're kind of a pair. They're not caused by the same bacteria, but they're transmitted in the same fashion. So we typically test for them in equal parts whenever we're testing. So, so it's important to visit with your doctor about the different types of sex that you're having. Because we find a lot of times, especially for men who have sex with men, some partners are only receptive partners, so they only are on the receptive side of sex. If you would test their urine for chlamydia and gonorrhea, you're not going to find it because they never had insertive sex. So it's really important to have that discussion with your doctor about what areas of your body may be infected and to test those sites accordingly.
So we've all been to the doctor, and you get asked if you are sexually active.
Mm-hmm.
Do you feel that doctors or physicians or healthcare providers in general are asking that question of specifically what type of sex you are engaging in at this point?
Yeah, I'm not in every physician's office. I'm not, having every conversation, but I do think it's something, at least when I go to the doctor, that's never been asked of me. So I would feel that it would probably be true for most other people too. So it's definitely something that you have to incorporate into that total sexual health history taking to really provide the best services for patients.
Do you think that people are too reserved about that topic? Like, I guess, like when you approach your physician and you're like, hey, I've been having a lot of sex.
Well,
it's kind of
an
like
awkward place.
Right.
Right. You feel like there's this person who you maybe don't know.
Right. You're at a walk-in, you don't know them, and you want to get tested. You would just rely on that physician to know that they're testing you for the right things in the right place, and not, by engaging in that conversation, you might get a bad result. So again, if you're a man who only has receptive anal sex, you go in to be tested for STDs. They test your urine and you're fine. You think you're fine when really you're not. You have chlamydia or gonorrhea.
So is it more of a solution that people just need to be more blunt? I guess, because this sounds like a cultural issue where like people just need to be like, hey, by the way, I'm out here doing this, and I need to be like, there needs to be like full disclosure to a doctor, right? Like, because it culturally we're like so reserved about sex, period, that it's just kind of like.
Yeah, I think it goes, both ways. I think physicians have to be obviously professional in how they're having a discussion, talking about the whole part of their patient. It's not stigmatizing. I don't care what you do. I just want to make sure that you're taken care of, no matter what you're doing. It takes the patient advocating for themselves too. If they're going in to make sure that they're clean of STDs, we want people to know there's more things to just that one test that you may need to know that you're fully, that you don't have chlamydia or gonorrhea.
Do you feel that there's cultural aspects that keep, even for a physician to approach the topic,
sure.
Because it's such a clinical topic and such a clinical
personal.
approach?
Yeah. It's very personal. Your sex life should stay in your bedroom and things like that, but it is part of your whole health too. So just like physicians ask you if you smoke or you drink or you do drugs, those are all very personal things too. How you have sex also impacts your health. So it should be part of that kind of just routinized panel of questions. And I think, the more it becomes common, the more everybody's asking everybody. It's not, about one particular person or how they look or what they've said, that it just becomes, I don't know how we're going to do that culture shift, but I think it's important to try to help push medicine forward.
No, I would definitely agree. And it seems like, I guess maybe one question that I kind of just bring up to the group at this point too, it seems like we've reached that position with certain aspects of sex, because erectile dysfunction is something that is discussed kind of out in the open, in public.
Commercials come on when I'm watching TV.
Yeah, exactly. So I'm just wondering what's been done maybe with erectile dysfunction that has kind of gotten at that place, maybe in our culture where make it less taboo, where it's talked about versus maybe some of these STIs.
Yeah. So, erectile dysfunction, why you see it so much is it's pharmaceutical companies who are actually promoting their medications. You're not going to probably, see a pharmaceutical company promoting Rocephin for the treatment of gonorrhea, out there in the mass media. But yeah, it's advertisement and commercialization to try to sell medication, I think, is why that's become kind of ubiquitous in our culture to talk about.
So you think it's just maybe an issue of so there's more of a profit motive, obviously, that we're talking about. But do you think if, say, that there were ads, more ads, like if Rocephin maybe was a bigger moneymaker or whatever, that there'd be more ads about it, and potentially there'd be more discussion just generally.
That's the thing with public health in general. We don't have the kinds of resources that other, big markets have to do a lot of that advertising, but it's something we try to do when we can, find the funding. But yeah, like you said too, is this really a big deal? This happens to other people. It's really not. It's happening to everybody. But, kind of the silver lining for, chlamydia, gonorrhea, if you catch it early, it's treatable with medication. It's not going to cause long-term damage. But if you let it go too long, if you don't go and get tested, if you don't take your treatment appropriately, if you don't ensure that you don't get reinfected, it can cause lasting damage. It can cause infertility. It can cause a lot of, repercussions for you as a young person when you kind of get older and you want to start that family and you can't because you let your chlamydia go too long or you didn't get tested. It's kind of a hard message, too, for young people who aren't really necessarily thinking for 10 years down the road when they may or may not want to start a family. So.
And you kind of specified that, like, for this young teenage years, this is like one of the most prime times where someone needs to be knowledgeable about these things. Do you feel that education on the topic has just been too lax? Like it's just been not enough has been done in that area to really educate people, or that there's been such a like the task of destigmatizing the entire topic to youth is just almost met with like this. I mean, I know when I was growing up and I got like the talk, I was like, wow, this is ridiculous, because like I would get shown like a couple of images where it was like, all right, there's like, this is what this will do to it if you ever have sex, and this is why you should never have sex.
Right.
And it's
It'll
like
fall off. It's like, no, it's not going to fall off, but yeah.
Wait, it won't.
No.
and so
Maybe not. I don't think so.
Yeah, we're learning things. We're learning things. But I guess in this case, it's like something where, it's almost comical that like they don't treat
that we've
kids.
not moved forward in the 21st century. I know, I agree. So I mean, in North Dakota, at least, sexual health education is usually like one day in 8th grade that you get taught about STDs. And it really depends on the school district, too. There's not like a standard curriculum of what you have to talk about in terms of STDs, HIV, any of that stuff. So, I mean, there's some teachers who are awesome. They do great. They give their students all of the best information, accurate information. Some don't know what to talk about. And so we're available to go out to schools and actually give that talk for teachers if they don't feel comfortable doing it. But yeah, I mean, it's kind of clinical and sterile and stuff too. But yeah, I mean, obviously there needs to be more done in terms of talking to kids. I mean, because this does impact your future. It's something that's probably imminent for you to know now, and it may impact your future.
It seems like the burden of like that. There's people that don't want to take on the burden of actually explaining this to kids because they're like, it makes me uncomfortable to talk about it at all.
Yeah.
And so like they're like, I don't want to have to explain the kid, because there's people that would say, well, it's parents' responsibility to talk to their kids about sex, and then there's parents that just don't want to do that. Like they don't want to talk to them about the dangers of STDs. They're like, if I cover my eyes and ears, it's just not going to happen. They're never going to grow up. They're always going to be my baby, right? Like that's
and your
like
kids out there with
children.
bad information, not knowing things and not making the best choice for themselves. So
Right.
It really, I mean, it's all about communication and conversations. And, we even have a hard time finding really great resources for parents to use to talk to their kids about sex. It's something we're wanting to work on in our STD program because we know it's so important. But yeah, even finding good resources for parents to even know where to begin or what's appropriate for my child at what age. Those resources are hard to find, too, even on the age of the internet.
Do kids actually read pamphlets? Because I'm
No.
almost in the belief that we don't. Like, I don't know how many times I've seen a kid like pick up a pamphlet and just like throw it. I've never been so like brass to just like pick one up and throw it away in front of someone. I've seen teenagers do that though. Like to me, that's just too cruel. But because at least like consider the message.
Yeah.
But like at the same time, it's like, do you think that in terms of as we go forward, as we become more I guess the word would be progressive in the sense in terms of educating our youth on this. Do you think that it's that the median in which people consume this information is extremely important? So like right now, like we have like Facebook, Twitter, like YouTube, like and it's kind of why we wanted to do like this
is why
kind of
this
show.
is great, because this might be the only situation in which somebody may be able to see adults having this conversation be completely normal. And they may learn something from this conversation.
Well, hopefully it's a normal conversation.
Yeah.
I don't know. Like conversations with this guy right here usually aren't really that normal. So, like
but it's not
I'm glad it's somewhat
embarrassing. It's
normal.
not, it's just it's just life. We all go through it. So
right.
We got to talk about it.
Well, exactly. And so you touched on the piece of the medium, and I think the medium is very important, but like kind of what I'm gathering from you is just also the tone in which this is discussed is so vitally important.
Right.
Because if you talked about it, it may be embarrassing for some parents to talk about it. And if you have somebody who is embarrassed to talk about it, talking to you about it, it makes it embarrassing for you.
Even though you may have a lot of questions, you're not going to move forward with those questions for fear that it's going to cause, some type of panic in your parent.
Exactly.
Yeah.
Or your teacher or whoever's talking to you about that.
Yeah.
Yeah. No, because we are, very social beings, and we pick up on those clues, whether or not they're in language that's used or just in body motion communication.
Yeah. And so learning it from your peers, in the hallway or from some magazine you pick up or whatever you see on the internet may not be, the best information for a lot of youth out there to know what normal sex habits and things that they should do to protect themselves are like.
And I guess, sorry to cut you off, just real quick to follow up on that, are there any specific resources online that you know of that people could be directed to if they were listening to this podcast or watching?
I can't think of any off the top of my head, like great resources. Again, especially we were looking a lot for parents talking to their kids. We had a hard time finding some things, but we're in the process of trying to develop some of those so that, you could come to the health department website, you could see like what's appropriate for me to start talking to my 8-year-old about, because there's a lot of things that aren't appropriate for an 8-year-old, but there are a lot of things that they need to start kind of learning about. Even, as young as 5, talking about healthy behaviors, hand washing, cleanliness, things like that are important. So that's something that we want to put out there. We don't have it there yet, but we feel that that's kind of important to, arm parents with the most appropriate information that's appropriate for their kids of their age group to kind of give them some confidence that what they're discussing is true and again, most appropriate.
Be a health empowered youth.
Yeah, and a parent. Yeah. So the clap is actually gonorrhea, and it's derived from the French word for brothel, which is like clapier or something like that.
Oh.
Which means rabbit hutch. So, like young French soldiers or soldiers would go into brothels or the rabbit hutch where they would have a lot of sex and they would get gonorrhea. So they called it the clap because they had gone there and got the clap.
And see, that's like mind blowing to me because when I was younger, I always connected the clap with chlamydia. So we're learning new things here today. And I guess, are there any other names for gonorrhea?
Yeah, so the one that I found, just again, I was on Urban Dictionary or whatever, so I'm going to probably.
This is where the youth learn. I can
right?
confirm. I've looked up numerous things on Urban Dictionary
right?
just to be like, what is this?
So the other thing that was on the Urban Dictionary for gonorrhea was the drip, and that's obviously due to the fact that there's in men some drippy just discharge that comes out if you'd have either chlamydia or gonorrhea.
Some of these sound like monsters, movie titles, like earlier, like the drip,
the drip,
clap.
the clap.
Yeah.
Well, and one thing I've noticed just on these two, they seem very men-centric.
Yeah. Well, men are the ones that are if they're gonna have symptoms, it's the discharge, the things like that. It's gonna be in men.
Okay. So do we see just kind of a quick aside? Do we see a similar thing in gonorrhea in women versus men, where it's more likely to be asymptomatic in women? Okay, okay, and it's important to discuss this terminology because as we all know, we have to be on the same page talking about all this stuff.
Asymptomatic what?
Asymptomatic, no symptoms.
Yeah. Oh, okay.
I have no idea.
So it's like invisible then.
It's invisible. Especially in women, because the area where you're infected is up inside your body. So it would take a lot of distance to kind of get that. Women do have discharge. Sometimes, usually it's later on in their infection. But what that chlamydia and what that gonorrhea is doing inside your body is it's causing a lot of inflammation, a lot of scar tissue, a lot of damage. And that's why it leads to something we call pelvic inflammatory disease, or it's referred to as PID. And that can lead to infertility and sterility in people who don't get their infections treated adequately and appropriately and soon enough.
See, that's another acronym. Just added to the list of running acronyms.
Yeah, we should keep like a running tally of all the medical acronyms.
Play it back here, right?
Yeah, here it is.
Yeah.
Okay, so do we have any other names for gonorrhea?
Those were the only ones that there's a lot of names out there, but those were kind of the two major ones that I saw that were appropriate for this venue.
For sure. And let's talk about chlamydia then.
Sure. So chlamydia, I've never heard this actually, but it was, I found it on a couple of different websites. They call it the clam, just short for chlamydia, I think. I don't know, it's kind of boring. And then I saw on a number of places gooey stuff, which I'm assuming is for the drip and the discharge as well. So
It's just called gooey stuff?
I guess. I don't know.
It's so
I've
easy
never
to
heard
see.
that, so.
Yeah, how these could get mixed up because you have the drip on one and gooey stuff.
Well, I mean, they manifest in the same way. They usually are normally transmitted in the same way. They kind of go together, but chlamydia is much more prevalent than gonorrhea. But yeah, we test for them together. You always get tested for them both at the same time. They kind of look the same. They do the same stuff, so.
Gooey stuff must have been made up at like 3 a.m. or
Yeah.
something like that. You know, like someone was just like, you know what?
man.
What's a good name for this? You know, I'm really tired. You
I
know,
really
I'm
got
like,
that gooey stuff.
I got that gooey stuff.
Kind
like,
of gross.
Man,
But yeah,
that's brilliant.
it's the
I think that's a
discharge.
fitting name, don't you? Yeah, I like
Yeah.
it. I like
Again, that's Urban Dictionary, so who knows? No idea.
All right, so we'll move on to herpes then.
Herpes. I don't know. Like, I didn't find any like names for herpes. I think people just kind of know them as herpes. They're really ubiquitous. So, people between the ages of 14 and 49, 1 in 6 of those people actually have genital herpes. So, just call it straight up what it is. It's herpes.
Straight
so,
up herpes.
you know, they come and go.
So
They're-
no one calls it the herps or anything like
Oh,
that?
probably.
Or like
I don't
anything
know.
Or the dots, or
the
can we
dots
make
or
up
like, you know.
So we have the drip and the gooey stuff. Are
Yeah.
we along that?
yeah, herpes. I don't know.
Straight up herpes.
You got to be careful else you're going to get them herps. like,
Good. Yeah.
oh, wow. So in essence, though, like, so there's all these different kind of names. Do you think like the terminology has a lot of like diffusion in terms of like people understanding? Because like right now, as we just illustrated, like if you would have just brought this to my attention, like just and said like, oh, you know, like any random nickname for it, I would have been like, what does that mean? Like at
Yeah.
all? Like because wouldn't have a clue. And so like, I guess do you find that like medical terminology in this area actually inhibits education for youth in this field, or do you think it's more of like, do nicknames actually help?
Yeah, I mean, I don't know. I think, you know, the nicknames are, the clinical terminology is kind of out there as well. Chlamydia and gonorrhea is something we've heard in popular culture as well. So I think in terms of some of those, I think their actual names are not hindered by the fact that people only know them by their other names. Because I had to look a lot of these up. So I'm not that old that I wouldn't have been exposed to a lot of those growing up. But yeah, we didn't talk about, you know, kind of those pet names, I guess, for these diseases, like when I was growing up anyway.
I feel like those names are just going to change like with time.
Oh,
like,
sure.
like just
Yeah.
like the
But, like,
next
clap
generation
has been around forever. So that one we kind of know. But yeah, that's our friend gonorrhea.
I guess whatever's most prevalent at the time among like
Yeah.
a certain generation, they're
Well,
going
and
to be
like
like,
back
that's the
then too,
nickname.
there was no treatment before penicillin. I mean, those first antibiotics, if you had it, you just had it forever. And so, you know, I saw when I was actually doing my research that the pinky finger out when you drink out of a glass of water used to indicate for other people that you had an STD.
Oh,
so that
really?
you could congregate together. Because you knew you weren't going to catch it, you know, so you can have sex with me. If you have an STD, I do too. So that's fine. We can do this thing together. So it was an indication to others.
Oh, wow.
I wonder
so
how
now,
that-
now I'm just...
Now you'll be paranoid about whether that finger goes out. I don't think that happens anymore, but kind of back in the day before people were treated, that was their
I'm going to keep
signal
my
to each
cups
other.
in a cup holder from now on and
Yeah.
just use straws, and no one's ever going to ask me my status about anything.
Well, it's funny to see how those things of
Change.
old kind of are reworked into completely new meanings
Yeah.
as time goes on.
They formed a secret club.
Yeah.
Like, that's kind of
That's
interesting.
a secret signal.
Yeah, like, come hither.
But yeah, I guess moving towards kind of another segment that we want to do on the show today. So we have 21 fish that we picked up, 21 fish game, and each one of these fish has an STD. So you had mentioned that you've done a little bit of research before before we spoke today. So what I would like to do is Skylar and I are going to go fishing, and then we're going to hit you kind of lightning fast.
Okay.
For some facts that
Okay.
you learned about these different diseases that we're going to catch.
Okay.
So, Skylar, you want to be our first fisherman?
Oh yeah, and so you got to do like the funny cast the line thing. So that didn't work out.
That just failed miserably.
Just waiting. Oh, come on.
Jeez.
When I said lightning fast, I meant lightning fast in fishing terms.
Oh yeah.
All right, we have our first one.
All right. Herpes.
Herpes. Well, like I said before, too, genital. Well, so herpes is kind of like two different things, right? So there's genital herpes, which is caused primarily by herpes simplex virus 2. And there's oral herpes, which is caused by herpes simplex virus 1. So most of us, by the time we get to adolescence, have been infected with herpes simplex 1 on our mouth. We'd probably get it from our parents, kissing us, other people kissing us, things like that. But then 1 in 6 people between the ages of, 14, 49 have genital herpes. So herpes simplex virus 2, which is generally found in the genital region. It comes and goes. It has periods of dormancy and periods of expression. So you'd get these outward facing sores and blisters that are very painful. But there are some antivirals that people can take to kind of suppress those outbreaks. But just because you're not having an outbreak doesn't mean that you can't transmit your herpes to another person. So again, it's really common. Doesn't cause like a lot of lifelong problems or cancers, at least that I've read or know about. They're just painful and they're irritating, and they will never go away. There's not a cure.
It's like a stealth.
Yeah.
Can oral herpes be spread to somebody's genitals?
Absolutely. So a person can be infected with the herpes simplex virus 2 orally as well. They can go vice versa, but mostly 1 is up here and 2 is down here. But yes, it absolutely can spread to other parts of your body.
Okay. Well, we'll go fishing for our next question STD, and I am looking for. All right,
There we go.
bluefish, and
right.
bluefish, gonorrhea. So hit
Gonorrhea.
us with some more gonorrhea knowledge.
Oh gosh, more gonorrhea knowledge. Well, we don't have as much gonorrhea in the United States, so we'll kind of talk about like prevalence, I guess, of gonorrhea. So at least in North Dakota, chlamydia is mostly in like young females. Gonorrhea is kind of like a little bit older females and males, 50-50, but we see a lot more gonorrhea in men who have sex with men as well. Yeah, that's where that site-specific screening is really important. We've, done some analysis to try to see, if you would have only tested urine, would you have missed, the rectal gonorrhea and things like that. And that happens so much and quite a bit. Gonorrhea, another quick tidbit, I guess. It can also, if you don't get it treated, it can spread in your body and disseminate and cause sepsis. It can also go to like your knees and other joints and cause arthritis as well too.
Oh, wow.
So you don't want a systemic gonococcal infection. It causes really painful arthritis.
And could we just have you define sepsis quickly for us?
Sure. So sepsis would be like an infection in your blood that's causing disease. So you'd be very ill that you'd have the systemic infection in your blood.
Okay. Well, we got 2 for 1 on that bluefish.
Yeah.
So we'll see what we get next.
All right.
Man, you're getting quicker.
I wanted this green one.
Says chlamydia.
Chlamydia. So, the most prevalent reported sexually transmitted infection in the United States. It's really the thing with chlamydia, especially for females. It's important to get screened. It's important to get treated for your chlamydial infection because of that long-term risk of PID and infertility. It's sad when we hear those stories of girls, who were 16, had chlamydia numerous times. Oh, I've also seen in research, I don't know if this is proven, but if you have chlamydia once, twice, 3 times, 4 times, like over time, that also completely has an impact too. So even if you get it once and get it treated, get it treated, that scarring that happens, doesn't kind of reverse itself. There was some statistic that said, like, if you have chlamydia at least 5 times in your life, your chances of ever having a baby is basically nil. So
Can you have chlamydia? Like, is the frequency rate of like infection for chlamydia like that it could be that common where you get in contact or you get reinfected 5 times before like the age of pregnancy?
Absolutely. So with chlamydia, we recommend that you abstain from sexual activity for at least 7 days, and a lot of times that doesn't happen. And if your partner's not treated, you're just going to get reinfected again. So you could go in, for a test of cure in the next 3 months. You test positive again, you get treated. Your partner doesn't get treated, get reinfected. You could have chlamydia forever, perpetually, and never actually get it treated if you don't follow those recommendations of abstaining for at least 7 days and making sure that your partner, whoever you're having sex with, is treated.
Hey, it cleaned up, and now all of a sudden
it could become like a ping pong match. It seems where you're just kind of giving it back
exactly.
and forth.
It is exactly a ping pong match. Yeah.
Oh wow.
Yeah.
Glad I played a lot of Pong when I was on the Atari, right?
Yeah.
All right. I believe it's, is it me?
Yep, it is you.
All right.
Let's see if your fishing skills pay off. It's like surprisingly more difficult than it looks.
Get him. There we go. All right. Syphilis.
So syphilis, we refer to that as the great imitator. It's fascinating. It's a spirochete. Syphilis, we've actually, not me, but in general, the world has never been able to grow syphilis in culture.
Oh, really?
Nobody's ever found a way that it grows anywhere outside the human body. So it's kind of tough to study in that way. It's spread primarily through sexual contact, but it doesn't just stay like in that area, kind of like chlamydia and gonorrhea stays in that general region of wherever you're infected. Syphilis becomes a systemic infection. So you actually are tested for syphilis in your blood and you find spirochete in your blood. And for that reason, syphilis can manifest anywhere in your body. So we're seeing a rise in ocular syphilis, or people who have syphilis in their eye. It causes eye damage, and it can lead to blindness if it's not treated appropriately. You can get syphilis in your brain. It can cause neurological damage. It can manifest in your heart. You can have myocardial syphilis as well. Go anywhere. And it can happen at any stage. So people used to think like, you only get that, you only go crazy, with syphilis, 20 years later, but it can happen within just a few weeks or months of being infected. It just depends on the person and their biology and what happens. Syphilis traditionally comes in a couple of waves. The first is you get a chancre. You get this great painful looking blister, but it's not painful. And the reason why it's not painful is it's destroyed every nerve ending in that area. So it really does hurt. You just don't have any nerves to actually feel that chancre. For men, it's mostly on their penis or on their genital area. So it's really kind of out there. You see it. It's not normal. But for women or men who only get, have receptive anal sex, it can be inside your body and you would actually never see it. And you would never go in to get treated. You feel fine. You don't feel anything. It's in there, but it's painless because it's destroyed all the nerve endings and it's really infectious at that point. So if you'd have another sexual partner or something like that, they're likely going to get syphilis. Then the next stage, like the secondary stage, which comes after that primary stage, there's kind of a period of time in which it all goes away. A lot of people get like a full systemic rash, but some people don't. Some people get a rash on the palms of their hands and the soles of their feet. Some people don't. So they kind of call it that rash, that great imitator. Sometimes it can look like contact dermatitis. Sometimes it's really nothing. People just get a few spots. A lot of people go into dermatologists and they just kind of, treat it like, see if it goes away. And it does. So it must be nothing. And then it kind of just goes into dormancy, but you're still infected and you're still, potentially your blood is infectious potentially with syphilis. If you don't have that rash or you don't have that chancre, you're probably not going to spread it to another person. So we generally say like after a year, you're probably not infectious anymore, but it's still in your body. It's steaming around. It's going to find places like your brain and your eyes and your heart to kind of take hold and potentially cause disease. So syphilis they refer to it as bad blood, and it is a bad bacteria. It can cause a lot of damage if it's not treated. Again, totally treatable. If you catch syphilis in the primary within that first year, you need one dose of penicillin.
So you just got to
Takes care of it.
keep an eye out to make sure that it's something that people are,
watching for,
especially if it's similar to other things. Like if you have frequent like symptoms coming up of even if they're different things, like you might want to consider getting checked out.
Yeah. And it's something for like all different types of physicians to know about. So you could go into the ER for something else. You could actually, a woman could go into her OB's office because she sees a sore in her genital area, but it's dermatologists, eye doctors, cardiologists, like all those different types of physicians kind of have to keep syphilis on the neurologists too, syphilis on their mind because it can take a long time for a lot of those symptoms to develop, or they could be imminent and look like a lot of other things.
All right. Well, thank you so much for your time today, Lindsay. We really appreciate, you coming to talk to us today about like STDs, especially like, with youth involved too, and like how important it is in terms of education. So it's very important to keep yourself educated on this topic. Definitely consider getting yourself checked out for whatever kind of symptoms you might encourage. Even if you might just think it's something else, it's usually a good idea to still get tested, still get checked out.
Yeah, everybody should get tested before they have a new them and their new sexual partner should be screened before they engage in any type of sexual activity. Can't catch an STD if neither of you have it. So
it's just a smart idea.
That's a really good idea.
Yeah.
For sure.
Well, and maybe a challenge for all our listeners as well. Try to have a matter-of-fact conversation about STDs with just somebody in your life and see how maybe difficult that is.
Yeah, someone who's usually might be a stick in the mud or something, try to like purposely go out and like get a rise out of them, you know what I mean?
You don't want to make them like embarrassed.
Maybe don't make them uncomfortable, but like just try to make them open up about something else more about like this topic, especially if it's your own partner too.
Yeah.
So make sure to actually get out and try to talk to them about this stuff. But if you happen to have any sort of other questions for Lindsay, please let us know down in the comments below. Also, as always, please leave a like, comment, and just subscribe if you'd like. And we want to thank you so much for your time, and thank you again, Lindsay.
You bet.
It is vitally important that we continue to talk about sex openly so that we can all have choices in our sexual lives instead of surprises. So as always, let's end with a toast. To knowledge good and true, to the future health of youth, and the prosperity that they bring. Cheers.